Hi, welcome to Mount Sinai, South Nassau. We're here from the physical therapy department, and we're here today to show you your exercise video. This video is going to show you how you can improve your strength and your flexibility before and after surgery.
So how often should I do my exercises?
So you want to do your exercises 6 times a day. We usually tell patients to try to do them before and after each meal. And you want to try to work up to doing each exercise 30 times.
So what kind of exercises should I do?
Well, if you come sit on the table, I'll go through each exercise with you. We'll demonstrate it and we'll practice. So the first exercise we're going to demonstrate is called an ankle pump. So what you're going to do is you're going to pump your ankle up and down as if you're stepping on and off a gas pedal. So why don't you try 3 of those? Ankle up and then down. Good. 1, 2, last one, 3. So that is called an ankle pump. The second exercise that we're going to demonstrate is called a quad set. What you can do for this exercise is take a towel and roll it up and place it underneath your ankle. What you want to do for this exercise is push your knee straight down into the table so that your thigh muscle contracts. And you want to hold that contraction for 2 to 3 seconds. So let's try this. Push your knee down into the table, make your thigh muscle contract, and hold. 1, 2, 3, and relax. Why don't you try 3 more? So you're going to push the knee down, hold that contraction, 1, 2, 3, and relax. And last one, push that knee down, hold that contraction, 1, 2, 3. Okay. Then that was a quad set. The next exercise that we're going to demonstrate is called a straight leg raise. And a straight leg raise is a progression from the exercise that I just showed you. So what you're going to do is take the towel roll out. You're going to bend your opposite knee. Okay. So the first part of the exercise is doing the quad set. So you're going to push your knee down into the table, making your thigh muscle hard. And then you're going to lift your leg up. Okay, that's good. However, your leg came too high. So a good rule of thumb is when you lift your leg up, you want to lift it about 12 inches. And what you can do is lift your leg up till it meets where your other knee is. And then bring it back down. Good. Let's do 3. So you're going to do a quad set, lift your leg up, meet it to your other knee, and bring it back down. Good. Let's do 2 more. Good. Last one. Good. And that is called a straight leg raise. The next exercise we're going to demonstrate is called a heel slide. So what you're going to do is you can keep this leg bent just for comfort. And you're going to slide your heel and bend your knee. That was good. However, you don't want your leg to come out to the side like that. You want your knee to stay nice and straight and lined with the ceiling. So let's try that one more time. We're going to slide your heel, keep your knee nice and straight. Good. Why don't you do 2 more? Good. And back down. And 1 more. If you needed to make this exercise easier for you, what you can do is you can grab that towel roll again. You could place the towel roll underneath your heel, and this would create less friction. This way it's easier to slide your heel up. So why don't you just show 1 rep of a heel slide with a towel roll. And that is a heel slide. So the next exercise that we're going to demonstrate is actually a stretch. and it's called a hamstring stretch. So what you're going to do is you're going to be seated, and you're going to try to reach forward and touch your toes. It's okay if you can't touch your toes. You just want to reach as far down as you can. When you reach, you want to hold this stretch for 30 seconds and then repeat that 3 times. If you can't hold it for 30 seconds, that's okay. You're just going to try to hold the stretch for as long as you can. You should feel the stretch behind your knees, and that's called a hamstring stretch. The next exercise that we're going to demonstrate is called a bicep curl. So what you want to do is you want to be seated with your palms facing up, and you want to bend your elbows and curl your arms up. Good. Do 3. Very good. If you wanted to make this exercise more challenging, you could add a weight. If you have a light hand weight at home, that would be good. If not, you could always grab a can of vegetables or even a water bottle. So this water bottle is filled with water. It adds some weight, and you could go ahead and do the same exercise. When you do this exercise, you should be feeling it right in your upper arm in this area. And that is a bicep curl. So the last exercise that we're going to demonstrate is a chair push-up. So you want to find yourself a secure, heavy chair that has 2 armrests on both sides. And what you're going to do is you're going to sit down in the chair. You're going to put your arms on the armrest, and you're going to stand up about halfway. That was good. However, you want to use both arms. So you're going to place your arms on either side of the armrest. Now stand up halfway. Good. Let's try 3 of those. 1, 2. Good. 1 more. Very good. This exercise strengthens your tricep muscle, which is the muscle located in the back of your arm, right here. That is a chair push-up.
So what should I do if I feel pain with anything?
If you have pain with any one of the exercises, you want to stop that exercise. And don't forget to breathe. Try not to hold your breath when you're performing your exercises.
Is there anything else I should know?
Yes. So you want to make sure that you're doing each exercise on both the left and the right side. You want to make sure that you're doing your exercises, like we said, 6 times a day. And a good way to remember that is before and after each meal. And you want to do each exercise 30 times each. Thank you for viewing our exercise video.
And thank you for choosing Mount Sinai, South Nassau.